I did a whole bunch of slides strictly based for the lawyers and also for the claims people on Ohio law. This is just in the slides. Which the point here is that you need to find out in your case, in your jurisdiction, just what they can recover for emotional distress. What is the standard for recovering emotional distress, especially in the absence of physical injury? It's going to be a state-by-state thing. So find out what they have to prove. In Ohio, they have to prove serious emotional distress, and that means severe and debilitating. Those are big words. They can't just say, I'm depressed or I have, anxiety. Severe and debilitating. So I'll just run, we're not going to go through all these. These are just zone of danger stuff. These are just things from Ohio I put in here because I'm not going to do a 50-state compendium, for goodness sakes, especially since I can't bill for it. But check in your jurisdiction what they can get, how they can get it, and what they have to prove. Okay. Now, what is the basis for emotional distress claims? I mean, what is the Bible for it? And the Bible is the DSM, Diagnostic and Statistical Manual of Mental Disorders. Maybe some of you guys know this. We're on the 5th edition text revision. It's gone through a whole lot of changes over the years. And that's where you start. Everyone should have one in their library. I have it in my office. Because this tells you every single known mental disorder to the American Psychiatric Association. And so you want to start with that. So it tells you diagnostic criteria, which you can use to defend the case, to test the expert for the plaintiff, and it tells you how to possibly make differential diagnoses. What else is going on with this person? So it's divided into what they call 5 axes. AXIS, axes is plural, of course, and the axes 1 and 2 tell you the detailed criteria. Axis 3 tells you physical disorders with emotional overtones, and then 4 talks about the severity of stressors that the plaintiff or the patient is experiencing, and then axis 5 is a global assessment of functioning, or GAF, which maybe some of you have heard of. Actually, 1 is the worst, and 90 is the best. No symptoms. Okay, so this is just I put this together, some of the allegations of emotional damage, like for instance, PTSD, post-traumatic stress disorder. That used to be called shell shock. It was invented for war. In World War II, they called it shell shock. And this can be very helpful when you're cross-examining a plaintiff's psychologist. We'll get into that in terms of how to make them look stupid, because they'll always take the bait on PTSD. I've never had a psychologist that won't. I'll get into that in a minute or soon. Post-traumatic stress disorder is the most common. I have PTSD from this accident, no matter how severe it was. And PTSD is a very specific diagnosis, so you have to really, really dig into it. It requires something outside the range of usual human experience. It used to require a life-threatening event, but now you can be a witness or learn about it. And Heather and I had a case where our driver crashed a red light, ran right into our driver crashed a red light, ran right into a guy who the night before had been holding his 2-month-old baby with a little lion costume for Halloween, and he died on November 1st. And he was on the phone with his wife, and she heard it happen. And you might say, well, so what? Well, he was 23, and the baby was 2 months old. Bad case, and even our psychologist said that qualifies for PTSD. So you can poo-poo it, but I hope none of you have a case like that. So just dig into. I'm going to run through these because we have limited time, and we're trying to load up Kurt's videos, and we'll get to Kurt in a minute. So just my only advice to you is read the diagnostic criteria, compare it to the expert's report, and compare it to your symptoms, because not everyone has PTSD from an accident. They can, It can be very real, but they might not. And if they're, yes, Kent.
Are you seeing treating physicians pull the trigger faster on putting a diagnosis
Sure.
of PTSD medical record?
They say it right away, and there's ways of getting around it. If somebody wants, I have a pat cross-examination. I've never missed on it with a psychologist, and I start with what are other examples of PTSD? Hurricane Katrina, 9/11, natural disasters, burns, fires, earthquakes, all that. And then you'll say, well, how about this accident? How does that compare? And everyone will always say, well, PTSD is PTSD, and that's when you have them. Okay, next one. So now we're going to talk about other things that they claim. You've seen generalized anxiety disorder. They'll throw that in. That is a catch-all psychological diagnosis when they don't have anything else to talk about. And you have to rule out other diagnoses. And you can't make that diagnosis if they have other things going on. So if anyone wants these slides, I'll send them to you. These are some of the criteria for GAD. That's a throw-in. That's just they have generalized anxiety disorder. Some psychologists will tell you they can develop phobias from an accident. They really can't. They'll say they can, and that's a battle of the experts. Usually phobias develop in early childhood. I, of course, have a phobia of speaking in public. And that didn't go over very well. Okay, so, and they generally are not, unless the person's really kooky, they generally are not really impaired. Doctors will talk about panic disorder. I have a panic disorder from this accident. Again, it's usually not from trauma. And so no sense going through all these. Dysthymia. Anybody hear of dysthymia? Dysthymia is like really bad depression. It's chronic, really bad depression, and you have to have it for at least 2 years, and then there's all kinds of things that you can ask about of symptoms that they should have. But quite often people who are depressed have other symptoms, or other conditions that they've had for a long time. Generally personality disorders, which we'll get into. So these are things that you have to really carefully explore with the plaintiff, with your expert, and with their expert to find out what else might be going on with this person. And then, of course, depression. People quite often claim depression, you know this, from accidents, from trauma, from especially serious accidents. And, again, it can be, I'm not going to poo-poo everything, but again, it might not. They might be depressed for a lot of other reasons, which is why we're going to get into all the stuff we have to explore with the plaintiff and with their records. So quite often people who have major depression have a family history of it. They have other organic physical problems like endocrine disorders, and often blood or medications can cause it, can help cause depression. Okay, we'll just run about with the TBI, neuropsychological claims of head injury. We all know about it, and again, I said I was going to try and do not too much TBI stuff. Just to go over it a little bit, usually people that claim a TBI, there's 3 kinds of TBIs, mild, moderate, and severe, and then there's with or without complications. So, you can have, if someone gets clunked on the head and they have a really bad like a hematoma, epidural or subdural hematoma, something like that, yeah, you can have it. I will tell you this. I don't know what you experience, but it is classic neurology that you cannot have a concussion without loss of consciousness, period. Now, doctors will dispute that, but that is a physical fact. So if they, the first record at the scene with the ambulance denies LOC, denies loss of consciousness, didn't lose consciousness, and then they try and say they did later on, focus on that. You really cannot have a concussion without loss of consciousness. Quite often a TBI claim will be because they got their neurologist or neurosurgeon won't help them. So they go to a psychologist, and the psychologist says, well, see, you wouldn't necessarily know they have a TBI, but I know they do. And this is why you have to get the best possible neuropsychologist, and I mean a neuropsychologist. You can also have a clinical psychologist, and some neuropsychologists are clinical psychologists, but sometimes in a emotional distress case, you need both. And I swear by neuropsychologists because they get all the records and they do significant amounts of testing. You have to have testing in a neuropsychological claim. And a lot of these are where it doesn't look like it's serious head trauma, but you know, they're saying they have these cognitive disorders. And these are some of the defenses to it. It just doesn't fit. It doesn't add up. Why are they saying this? And what type of testing is their neuropsychologist or their psychologist administering? There's tons and tons of these tests. And you have to work with your neuropsychologist on that. I don't have the time to go into a lot of detail on this. The classic first testing is the MMPI. They made me take one when I was getting married to Eileen because I had been divorced, and they sent me to a priest who was also a psychologist, which pissed me off. So I took it, and then he interviewed me, and he said, "Tell me about your family." And I told him he started crying, and he said, "You can get married." That's a true story. 1985, 86 maybe by then. Anyways, the MMPI is 567 questions, true, false, and they'll almost always administer it. And it doesn't just have clinical scales. The key is the validity scales or the veracity scales. There are checks in the MMPI to see if someone's trying to game the system. Those are the validity scales. So don't ever accept an MMPI result unless there has been validity testing. These are some of the things that the clinical scales test for, and you will see some of the things we're going to talk about later. And the validity scales, there's actually a scale called the LIE scale, which I think is kind of cool, and they test for those. There's 4 validity scales and 10 clinical scales. The other thing that's kind of out of date is the Wechsler, though some people will still administer this, and they draw pictures and do block designs and things like that. And then there's the MILON, not million, the MILON Clinical Personality Inventory, and that's another personality test. Now, what are some of the things that these people who come to us in accidents and are claiming psychological injury, what are some of the other things that they may have? And there's something called conversion disorder, what it sounds like. This is someone who wants to get over on the system, and so they invent claims to try and either mask other things that are going on with them or just get money. And it can happen. Conversion disorder. Somatization disorder. This is where someone has a mental disorder and they bootstrap it and create physical conditions. But this is usually pre-existing. It almost always is. And this is something you have to look to as being another explanation for what's going on with this person. Similar to somatization disorder, somatoform disorder, psychogenic pain disorder. The diagnosis is in people who are workaholics, physical trauma, or hold strenuous or routine jobs. In other words, lawyers and claims people. So these are people that would have, a reason for having physical complaints. Usually it comes in the ages between the 30s and 40s, and a similar name for this is hypochondriasis. Schizophrenia. Well, you know what? It's real, and that's not just a mental disorder, it's a psychotic disorder, and it's very, very serious. You don't see a lot of them, but they're all things that need to be considered. And everyone thinks schizophrenia is multiple personalities, but it's really not. Schizophrenia is delusions or having voices, things like that. So we look for that. Obsessive compulsive disorder. Again, something that's not traumatically caused, but this person might have it, and the proper diagnosis might be this as opposed to something from the trauma. These are all things that we're going to be looking at to try and explain what's going on with this person. And, you know, if you want these, just, you can get the slides from me. Now, personality disorders I'm particularly interested in because they're very real and they cannot be caused by trauma. They're usually present in adolescence or early adulthood. And there's a lot of them. And some of these people who have a claim of trauma really have a personality disorder. And there's several, and we'll go through them real quickly. Paranoid, schizotypal, or obsessive compulsive personality disorder. Want to look for that, or your psychologist, your expert psychologist should be looking for that. Borderline personality disorder. Borderline personality disorder is really, really serious. They don't say it to be flippant. They're borderline psychotic. And people that have this disorder often have extreme mood swings, binge behavior. They're arrogant, they have a sense of entitlement, and they actually literally border on the psychotic. I see some people getting real nervous here in the room. Histrionic. These are people who are just really, really over-emotional, over-dramatic. They're histrionic, it's a perfect word. And they're self-centered, they're dramatic, they want to be the center of attention. They complain of poor health a lot. So in their records, you get those records, they'll be complaining of stuff that's not, I'm miserable, I'm really sick, I'm always sick. This is why getting records, and you know, it's crucial to get the records, and the insurance companies have to authorize paying for that. We have to get these records, they're crucial. If you don't get them, then you're not going to have as good of a defense. They're dramatic. Narcissistic personality disorder. This is someone who's just an absolute narcissist. Usually they have orange hair and we're the president. Anyways, they're grandiose, they seek attention, they're self-important, they exaggerate everything. Me, 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 you know, everything's about them. But they're, you know, tears of a clown, down deep, they're really depressed and they have big problems. So there's a story about the person who's a narcissist, and he's at a party and he's talking about himself and everyone's getting uncomfortable, and he realizes that, so he says, well, enough about me, let's talk about you. What do you think of me? That's the classic narcissist. And so they're just really, really self-centered. And you'll see plants like that, right? That's why you have to really take their depositions and find out as much as you can about them, which we'll get to with Kurt. The avoidant personality disorder. They're timid. They're just uncomfortable. They're extremely sensitive, hurt by criticism. They exaggerate difficulties, and they avoid interpersonal relationships. Again, how are you going to find out about this? Well, the deposition, of course, but the records. This will come out in a lot of these people's records. The dependent personality disorder. Remember, these are all things that are supposed to show up in adolescence or early adulthood. So family members might give you some insight on this. These people have no self-confidence. They fear abandonment, and they are extremely dependent and submissive, docile people. Again, not any one of these symptoms, but all of them together. The passive-aggressive, sure nobody does that here, but they're always trying to gaslight or be someone that's, they'll do something, they'll behave in such a way to suck you in, to get a reaction. Passive-aggressive. And, you know, you've been around them. They're just passive-aggressive. I don't know how else to say it. Malingering. Now, this used to be, when I started in 1980, they diagnosed this all the time. It's really not very, it's not used very often anymore, but it does exist. It's not truly a mental disorder, but it is diagnosable, and it's usually a psychiatric disorder. You got to be careful because, you know, one of the things like from Rob's and Rebecca's and Phyllis's presentation was, what's important in a case? Well, the plaintiff is the most important thing in a case, and you want to be careful. If they're a plaintiff that people are going to like, they're sympathetic, you really want to be careful about calling someone a malingerer. That is a tough thing. But I've had it. I mean, I haven't had it, but I've seen it, and you want to be careful. That's sort of a last resort type thing. Now, what about medication? There's many medications out there that people take. And of course, if someone's taking Prozac or, you know, a psychotropic drug or an antidepressant, and there's nothing wrong with that. I'm not going to criticize people. A lot of people are on medications. They do wonderful things. But they can have significant side effects. And that's why you have to find out everything this person is taking or has taken, and get their list of medications. I had a woman years ago. It was a really terrible accident, but she miraculously wasn't physically hurt too badly. She had all kinds of mental problems, and she was on the list of medications like this. My psychologist couldn't believe it. So he and I broke down every single medication. The physician's desk reference, I don't know if you use that, but it's still valid. And we found out so many drug interactions and so many symptoms from the medication she was taking before the accident. Medication is really, really important to find out about. Of course, if they're taking, like I said, if they're taking anti-anxiety or antidepressants, that's a red flag right there. Okay, procuring records. I can't minimize the importance of getting every single record you can get your hands on. That means careful interrogatories, careful depositions, careful finding out everything that this person has treated for and getting the proper authorizations. And that, you know, for the lawyers and their paralegals, now we have 4 registered nurses who are paralegals in our office. We're really fortunate. So those young ladies are my right arm. They know how to get all that stuff, and they know how to write authorizations. But you better know how to get the records. And HIPAA, great law because it protects people's privacy, but it also makes it much tougher for us to get records. And by the way, it's HIPAA, Health Insurance Portability and Accessibility Act, I think. And you have to do HIPAA-compliant authorizations. And so we have to, you know, a lot of this stuff is protected, especially, you know, mental, psychological stuff, not just physical. So you have to do the right authorizations and put the elbow grease in and pay what it costs to get the records. And then if you have to go to the court, you go to the court. I haven't had to do that too much. And PHI is the anagram for protected health information.
Hey, Joe.
Yes, sir.
Have you, in Iowa, about 5 years ago, the Supreme Court issued an opinion on a garden variety emotional distress case. We can't get prior counseling records. So if somebody has but they use the term garden variety, which drives me nuts, because the plaintiff's attorney thinks their case is garden variety. But they allege severe emotional stress from a broken leg.
Yeah.
And the records refer to counseling 10 years ago. I can't get those prior counseling.
That blows my mind. I can't relate to that because you'll find out things in those records. So I don't know what to tell you about that. I mean, I'm lucky, I guess.
I didn't know if that was a trend.
I don't see it. I don't know. Maybe people can sound off on that.
Do you file a motion and the judge says no?
He says the law.
That's right.
Oh,
there's a Supreme Court opinion. And so the issue is this a garden variety emotional distress case or a severe or a major depressive disorder case? And it really gets murky. The judge's default is, well, no, you don't get it.
Well,
And the language of law is garden variety.
Because my friend who was on the defense side used that term in their brief and in the argument for the Supreme Court. Off the back, the Supreme Court was no! And then he adopted the term, and now it's in the opinion, and now it's
unbelievable.
garden variety emotional.
I don't know. All I know is that, again, this gets back to the first thing I said. Find out what your law requires for recovery. Even in cases, like in my state, even in cases where there is contemporaneous physical injury, you still have to show severe emotional distress or serious emotional stress. Remember, severe and debilitating. Three great words. I guess I'm lucky in Ohio. Okay, so this is all about procuring records. The reason I'm going kind of fast is I want you to see what Kurt has to offer. Are you loaded up?
Yeah, we're good.
Good. I want you to see what Kurt has to offer on how to test people's claims of TBI or emotional distress, and I want you to see those videos, and Kurt gave a speech, I think, a couple years ago, and the lawyer said, "Oh, I'll let you guys talk. I'm just going to introduce you," and then this person went ahead and used up all the time. So Kurt's a little gun shy, but I'm not going to do that. How about other records that are not medical records? Credit, driving records, school records. Really important to get the school records, including high school. You know, remember, personality disorders show up in adolescence. Get those school records. See what they're kind of, what makes these people tick. Employment, income tax, insurance, legal, and of course military. Do I have that on there? I should. Military, I should put that on there. Military, if they're in the military, they get all these fitness reports. If they're in the Army, any of the branches of service, they have fitness reports, okay? Sports records, all that kind of stuff. Oh, why income tax records? Well, they might be taking credits for, medical bills or medical treatment and so forth beyond the normal threshold. You want to find out about that. And, of course, these are the ones that are a little bit dicier. But what about diaries? Everyone should be asking plaintiffs in their deposition, you keep a diary? Sometimes they'll proudly give it to you. Great, because that shows a lot of the histrionic, narcissistic stuff. I like diaries. And they'll always say they're 10 out of 10, in pain, which is the worst pain you can imagine. The histrionic, narcissistic types will do that. Go ahead and let them exaggerate all they want. Okay, that's it for me. Does anyone have? I kind of ran through those. Again, get the DSM-5, get the most recent one, get the PDR, and dig into these things. It takes a lot of work. And it's not all TBIs. There's a lot of things going on with people that are not necessarily from the accident.